going to look at the difference. So we are going to differentiate the TTP versus the HUS. So what is the TTP and what is HUS? So to look at it, the TTP stands for the thrombotic thrombocytopenic. So thrombotic thrombocytopenic purpura versus what is the HUS? HUS is the hemolytic uremic syndrome. So now let's dive into it. So the first we are going to talk about the TTP, that is a thrombotic thrombocytopenic purpura. So under TTP, what is the causative agent? So the causative agent is that it is a deficiency. It is a deficiency of the antibodies to the metalloprotease. So it's a deficiency to the antibody to the metalloprotease. So it is a metalloprotease, that is the ADAM TS13. So the ADAM 3S TS13. Next, what about the GI prodrome? So GI prodrome, so here it is uncommon. So what about the age group? So when you look at the age group affected, it affects the adults. Next we move on to the sex which is affected. So sex affected here in case of TTP is nothing but the females are affected. Now moving at the relapses. So in terms of relapses, the TTP, it is common. Relapse is common. And what about the renal impairment? The renal impairment is that impairment. So in renal impairment, it is usually mild, mild, mild. And what about in case of the severe thrombocytopenia? So in case of severe thrombocytopenia, the TTP, it is, in case of this, it is very often that there is a severe thrombocytopenia. So this was about the TTP. Now let's go into the HUS. So what happens in case of the hemolytic uremic syndrome? So in hemolytic uremic syndrome, what is the causative agent? The causative agent is nothing but there is E. coli. So E. coli is the causative agent, and causative agent, this is nothing but the 0157 and H7. So this is the E. coli. Now we look at the GI prodrome. So in case of GI prodrome, it is very common, that is, it is often seen. Now we look at the age. What about the age group affected? So in case of HUS, that is a hemolytic uremic syndrome, it is common in case of the children. Then what about the sex which is affected? So HUS, the sex affected is nothing but there is no sex predilection. This is the scene. Now we move on to the relapses. What is the relapse? So in terms of the relapses, it is HUS is rare. Next is what about the renal impairment? So in terms of renal impairment, it is very severe. HUS, as you can say, it is very severe. Then what about the severe thrombocytopenia? So in case of severe thrombocytopenia, the HUS, it is very rare. So in this video, we saw the differences between the TTP and HUS. To name a few points, we saw the features such as the causative agent, the sex which is affected, relapses, renal impairment, to name a few. And to learn and grow daily like this, please do subscribe.